Hello everyone, I am Dr. Harshini AS, consultant rheumatologist in Bangalore. Let us learn about treating acute gout attacks. What is gout? Gout is an acute inflammation in the joint which is triggered by deposition of uric acid in the form of crystals in the joint. So what happens in gout? Gout presents with sudden severe pain in any one joint, mostly in the legs, and it can start within just a few minutes to few hours. Most often, patients develop pain overnight and it is so severe that they may have to land up in emergency within a few hours. So, how to manage this gout episode? What we need to understand is there are a few things which needs to be done immediately and also few medicines which needs to be taken for long-term prevention. So, what do you do immediately after an acute attack? So, whenever a joint is inflamed and swollen, try to apply ice packs over the joint which gives some amount of relief. Medications like anti-inflammatory, which includes naproxen, indomethacin and many other medications, gives immediate relief from pain. Apart from anti-inflammatory, steroids may have to be given in the form of either tablets or injection into the joint directly. Also, a medicine called as colchicine may be very effective if it is started at a very early stage. Apart from managing the acute episode, which usually lasts for about 1 or 2 weeks and subsides with medications, subsequently what we need to understand is the episode has been triggered by high uric acid and that needs to be addressed as well. So, we need to start medications specifically to control the uric acid levels, which could include tablets like febuxostat or allopurinol. The decision of starting the medication depends on multiple factors. We prefer not to start these medicines during an acute episode, but this is started subsequently to keep the uric acid levels under control and prevent further attacks from happening. Apart from medications, there are multiple lifestyle modifications which needs to be followed in any patient who suffers with gout. Most importantly, gout is often seen in people who are obese and hence weight control and regular physical activity is very important. Avoiding smoking is extremely important as that can also trigger the episodes. Alcoholic beverages, especially like beer, can trigger an episode and that also needs to be avoided. Dietary modifications in the form of low purine diet needs to be strictly followed to keep the uric acid levels under control. All of you need to know that it is important to treat this disease immediately, but at the same time, you should not be scared. It is a disease which can be very well controlled with medications and lifestyle modifications. Hence, take precautions at the earliest and see your doctor to get treated adequately.